Welcome to the channel, and let's today see a patient who has this ring which you see in the center, and this is something which is formed because of anterior uveitis, because the iris is going to secrete fibrin over here, and this sort of is deposited on the anterior surface of the lens when the lens is resting on the surface of when the iris rests on the surface of the lens like this. So it's when it's in this position, then it will produce this area of Synechiae formation. Let's see on a slit lamp how does it look like, and we'll go forward on this thing, and you can see this patient has got mm, formation of this ring as I showed you earlier, and then we want to examine this patient and you want to see the ciliary congestion which is visible over here. The ciliary congestion is on the sides over here, and you can see this hypopion at the lower part over here. So you want to identify these things which are present in patients with uveitis, and then you need to go forward and look for the size of the pupil. The size of the pupil is dilated. There is no posterior Synechiae formation. The pupil is round. So the reason is we used a dilating drop which broke that Synechiae, and with that we were able to get a dilated pupil. And the important part is if we did not break the Synechiae over in this whitish ring, we might have had a 360-degree posterior Synechiae that would produce an iris bombay. And when you're looking in the anterior chamber, most important part, you shine the light from the temporal area of the pupil onto the nasal area of the pupil, and you can see the Tyndall effect over here. When the light shines in this area, you would see cells in this area, and these were the cells which we're trying to see in this patient with anterior uveitis. And once you identified those cells, you can grade those cells into cells as +1, 2, or 3, and then 1 plus cells, and then once you bring them onto follow-up, you can sort of see if they're increasing in number or they're decreasing in number. We go forward. The take-home message in this patient is always look for iris bombay in patients who've had posterior Synechiae formation, and reduce mydriatic once your uveitis of the patient is controlled. You can start off, if there's a very severe uveitis, start off with atropine. That is going to be the best mydriatic, which will sort of break open that Synechiae. And once that's controlled, you can bring it down, because atropine will sort of keep the pupil dilated for a long time. So as soon as it's dilated, you just want to bring it down with cyclopentolate and then drop it down to tropicamide. And once it's better off control, you can just so reduce it to overnight, because Synechiae can form in a dilated position, which you don't want to happen. You want that pupil to keep swinging for the whole of the life of the patient, because that gives them the depth of focus, the control of light in the day and night vision. So thank you very much for watching. Hope you enjoy this video.